So my name is Shannon Sullivan. I am a clinical professor of sleep medicine at Stanford, and I am appointed in the Department of Pediatrics because my background is in pediatric pulmonary medicine. And so I'm in pulmonary asthma and sleep division there, and then also by courtesy in the Department of Psychiatry where the sleep division is. I first started in sleep medicine in 2007 here at Stanford University in this very building at 401 Quarry Road. On the third floor, the lab and the clinic space both existed. I came here actually almost this time of year to the day, the year prior, to interview for a fellowship. My first interview was with Dr. Christian Guilleminault. And I had already determined that I was interested in sleep medicine, and that 30-minute conversation solidified my interest permanently. He was that kind of a mentor. I was also interviewed by Dr. Jed Black, Rafael Pelayo, some of the names that you may have heard before. Again, started fellowship in 2007. That's a one-year fellowship, completed in 2008, and faced a choice on whether or not to return to pediatric pulmonary medicine full-time or continue on in sleep. And I chose to continue on in sleep. I'm so very glad I did. I have seen adults and children, people of all ages, since that time. And I find that that's one of the unique and actually really important things in our field, that you can be 0, you can be 100, and any number in between, and be treated by a sleep medicine physician for your condition. And I think it's especially important to follow conditions over the lifespan. It's also important because many sleep disorders are very familial in nature, and siloing care in a pediatric house or in an adult house eliminates opportunities to be able to provide ideal care. Well, I think in terms of the development of pediatric sleep medicine, I think one of the important things to consider is that there are unique aspects of sleep within the pediatric age ranges. In fact, pediatrics is a lifetime within a lifetime. And so all of the developmental aspects of sleep that are laid out in utero through infancy and early childhood, and then middle childhood and adolescence, there's just a wealth of changes that are happening and development that's happening that's very unique to pediatrics. That said, I think it's very important to recognize that some of the influences on sleep and certain sleep disorders, as they evolve in childhood, can have long-ranging consequences into adulthood. And that recognition is more difficult, again, in an overly siloed approach to sleep and sleep disorders. So I think one thing that's very important, and one thing that's been very valuable to me, I feel very lucky to be able to do, is to be able to see generations in the same family, grandparents, parents, and children, and understand a little bit about what the evolution can be of sleep disorders, at least within families. From my very first, in terms of my interactions with the history of Stanford, one of the reasons I was interested in sleep actually initially was that the big questions, the field is so young, and the big questions were still being understood. And there were so many unknowns, very many fundamental things that we were still learning. The learning curve in the field is like this. It's just a steep curve, and that's an exciting place to be in clinical medicine. And I loved that about it. That was number one. Along those lines, the folks who really started this field were still alive and we're still working, especially when that's true to this day, but it was especially true back in 2006, 2007, when I was making my decision to join the field. Bill DeVent, Michel Jouvet, Christian Guilleminault. And it wasn't that these were names on a door and you never saw these individuals. This was an incredibly humming, active place to be, and it remains so. But with those individuals, man, we had a sleep ground rounds every Friday. People would come in from across campus, from the community, to attend those grand rounds. Craig Heller would be there. Bill would be there with his notebook and his pen, writing notes, ready to ask questions when the presenter was done. Ruth O'Hara would be there. It just was this incredible amalgam of people from different backgrounds and different walks within sleep research, clinical practice, and across the different departments within the university, which is also very important. And to bring those people together, it was a catalyst and a crucible for developments that have happened since then. And it was just magical to be part of that. I have a lot of stories about Christian Guilleminault in particular, because he was a tireless educator and a tireless advocate in patient care. And it's hard to pick just one, but I can tell you, or pick two, germane to those early days, the fire he had, the drive he had to bring everyone along on this fantastic journey of learning and education was so evident in everything he did. So here's a simple one. One of the reasons that we had a very productive lab, as Sharon mentioned, one of the things that's so important is that technologists and physicians are sitting side by side and working together and understanding patterns and identifying what might be going on with a patient in a sleep study. Well, one of the reasons it was so fun to be a sleep technologist and challenging at Stanford is that Christian Guilleminault would show up around 4 a.m. or 4:15 every morning. And he would want to know what was going on in every single one of the bedrooms where sleep studies were happening. Now, there were 8 bedrooms in this building here. There were another 8 bedrooms in those days in the basement of the Hoover Pavilion, which has since been renovated. And he'd be looking at the data for the 8 bedrooms here, and man, oh man, you better have been titrating correctly. You better be picking up the subtle things that might be happening with your patient, because he would be there making suggestions, asking questions, wondering what was happening. So I actually think that level set such a high bar for the way we conducted those clinical studies in a way that filtered down to everything we did. We as fellows needed to be there by 8 o'clock. I remember very early on in my fellowship showing up with a cardboard cup of coffee. And Christian, man, if you did anything wrong, it would be the guillotine. He would joke about his guillotine. That was a guillotinable offense. I needed to set down my cup of coffee because he explained you need both hands to read a sleep study. And the reason, and he was 100% right, because you needed to be scrolling forward at different paper speeds, as it were. You needed to be able to zoom in. You needed to be able to recalibrate your signals appropriately. It's a very active thing, reading a PSG well. And he is the one who instilled that in all 8 of the fellows. And he'd be walking behind you and watching the way you were reading your studies, each and every one. Having, by the way, already read them himself before we ever showed up. Every study was already read by Dr. Guilleminault. So we just needed to sit there and he would check us. Where was non-REM sleep? Where was REM sleep? What did you show me what you scored? And he also had us read the studies without any scoring. So it was us doing the original scoring as sleep medicine fellows. I think he set the bar high, and I think he gave 110%, and he expected that of the people around him, and that, again, I think made it fun to be here, but also was a great education. I mean, one of my enduring, again, a lot of memories, one of my enduring memories of Bill would be his engagement at those Friday grand rounds that we had every Friday, sitting there at the front seat, usually like a tablet of paper and pen in hand, listening to everything, writing down questions, never use an acronym with Bill. You needed to, if you're going to use an acronym, you needed to spell that out for your audience. So, he thought that was the right thing to do. But he was such an active learner the entire time I knew him. The genuine curiosity and absorption of new ideas and new things that were constantly rolling in to that room. It was incredible. And again, it was learned by example. This is how you drive towards excellence. This is how you bring people together from different disciplines across a university and across a community towards excellence. So Bill and Christian and Sharon were incredibly involved for many years in the organizations that came out of the development and coalescence of this field. And it was a pretty magical place to be as a trainee because it offered, number one, insight into the structural growth of the field, but also opportunity. And I mean that in both informal and formally. Certainly formally, opportunities to get involved. If you asked a question around Stanford Sleep Medicine Center, and again, this is still true, you could be plugged into the right group of mentors or the right group of individuals to be able to follow that question through or follow your interest through and be able to execute on that. But informally, because of their level of involvement, there was a broad cast of characters that would filter through our center at all times. So in any given week, you might show up and you would have another couple of individuals who had come to observe the clinic or shadow in the clinic or shadow with Bill for any length of time. It might be a week, it might be a month, it might be a year, and contribute to the overall enterprise. And I think part of that was because of the recognition they had in the field and their role in building and developing it and really building those early agendas on how to establish as a field and then flourish. So Jeb Black was my program director. For sure, on our first day of orientation, it was, here's the ICSD-2. Please purchase a copy. You must become members of the American Academy of Sleep Medicine. It's an inexpensive rate. You are given an educational stipend that will cover it. You all will be fellow members, and you will all go to the meeting next June. This was a program requirement in our mind. It was expressed to us as a program requirement. And that was important to know. Right out of the gate, you make a commitment to this field and you learn how you can grow with it and contribute to it. For sure, the attitude of involvement and commitment and the mandate to give back, research, organizational volunteerism, advocacy at a number of different levels, whether it be at the patient care level or in the national organization, those fires were certainly kindled by the passion and commitment that we saw all around us here. For myself, I became very involved in the American Academy of Sleep Medicine over the years. It started in 2015 with a role in the Transportation Safety Task Force that grew into involvement with the Presidential Committee on Occupational Well-being related to sleep. And that grew into commitments in the Public Safety Committee, where I was a member and then a vice chair and eventually a chair. We have tackled advocacy and regulatory guidance related to sleep disorders at the national level, and considered things as diverse as the importance of understanding and treating sleep disorders in individuals in safety-sensitive occupations, things like truck drivers and airline pilots, all the way through to contemplating public health issues like the twice-yearly clock change that occurs every spring and every fall, and what that means for public health, or school start times and how school start times have an influence on health of adolescents and of safety. So all of these things are really, I owe my participation and commitment to these roles to my early mentors here at Stanford. There are a number of different fronts that are really critical to the continued growth of this field. And there's a couple really special attributes that this field has that I think will allow it to be nimble and to be able to meet the challenges well. The first attribute that I think is important is the inherently multidisciplinary nature of our field. You could see that as a liability, but I do not. I think that is a great strength. Sleep exists at the intersection of neuroscience, of psychiatry, of neurology, pulmonary medicine, surgery. It is an amalgam. And I think that provides a great deal of structural strength to the field overall. That said, the field as it grows we have to continue growing. Sleep disorders, generally speaking, are underdiagnosed and undertreated. And I think it's important that we focus on pipeline issues for the field and that we continue to be able to work towards training folks in all of our core specialties that feed into the sleep medicine training. So I think that's one important challenge for the field. I think the other one is practice viability. is really being able to express why it is that sleep is so fundamental to health, so essential to health, and how do we translate that among our medical colleagues, but also among the public. So this becomes something that is a joint endeavor. As someone today may have already mentioned, the American Health Association now recognizes that sleep is one of life's essential 8. So I think we're making great progress here. We are all partners together in elevating sleep as a core element of health. And we need to be able to grow the field to meet the demand, the clinical demands, but also to spread the word and to continue to be able to do work at sort of at the public health level as well. Well, I agree with that. So in terms of people who want to get into the field, I agree with what Sharon Keenan mentioned earlier, which is that you have to have the temperament of curiosity and someone who wants to work hard, because it's work to be able to continue to grow the field. However, there's such a sense of passion among people who do work in sleep. In many ways, I feel like this is a family, and we are working together to be able to promote sleep, both clinically in medicine and in the public health domain. So I think energy, passion, and a sense of hard work are important. I would also say there's a place for you in sleep medicine, which is really different than other specialties. I think that there are so many different ways to be involved in the growth in patient care and research and the growth of this field that, again, it's well represented by the number of specialties that feed into sleep medicine clinical fellowship. It's also true on the research side that there's a place for people from very diverse parts of the clinical and research worlds. And I think that's very important for our field. So the role of the Academy in promoting the future of sleep medicine is, number one, critical. And number two is a blend of grassroots approaches, really where the rubber hits the road. Number one, in encouraging more young people. And I also agree it's important to start very early. There's a dearth of sleep education at every level of education, including medical school, including residencies, because there's so many competing topics that are necessary to teach. So I think that starting with education is something that the Academy has been focused on, and with good results. I think that once someone makes a choice to go into sleep medicine or into sleep research, it's also important to have the tools to be able to grow your own practice and to continue to learn and continue to have stoke that curiosity and maintain innovation. And that can happen at a number of levels. And I think the Academy does that well. And the final thing is, going back to there's a place for everyone in sleep medicine, it's taking a really inclusive approach and understanding and in a really nuanced way, the role of sleep in a variety of different communities, no matter what your walk in life, no matter what your particular background, understanding that, articulating that, and being inclusive as we approach growing the field, I think is critical. So responding to the concern that the pediatric world is a little behind the adult world in terms of growth and inclusion, I think I would push back on it. I think that there are always tensions. There are natural tensions that can develop depending on what your clinical focus is. You could make the same comparison with neurologists who maybe are really only working in neurodegenerative diseases, for example. I don't think it's true. I actually think the strength of our field is that from training on out, you learn to recognize and understand the different presentations, for example, of clinical sleep disorders across the age range. You may not, in your practice, choose to or have the opportunity to serve each one of those types of patients, but you're educated and trained in that and can then approach your patients with a more holistic perspective. I personally believe that sleep and sleep medicine is a cradle to grave practice, like I mentioned before. And so I'm not sure that the value of that is truly realized by splintering off pediatrics as an entirely separate endeavor. I think it's very important for us, for example, to understand the transitions that occur in early life, the responses we have to particular sleep disorders in early life, and how that plays out over the next 6 or 7 decades of life. And I think right at that interface of transition, especially in adolescence and young adulthood, is a critical place where we can make a difference for people. So I'm actually a believer that it's important to have that our one of our strengths is in our diversity of our backgrounds in education, our approaches, and our viewpoints. Yeah. So the question of what's the recognition of pediatric sleep disorders in the pediatric population, or even sleep symptoms that need to be addressed within the pediatric population, I do think that we've made substantial inroads. I think there's a lot of work left to do. But as evidence of that, in my pediatric practice, my referrals may come from general pediatricians for sure, but they also come from dentists, they come from orthodontists, they come from allergy, they come from ear, nose, and throat surgery. There are a variety of different referral sources, which to me says, speech therapy is another one. The folks who are evaluating and treating children for a variety of different complaints are thinking about, but what about sleep? And let me ask you a few questions about how you sleep and how refreshed you are the next day and how your daytime function is. Developmental pediatrics is another one, in behavioral pediatrics. So I think it's much more recognized these days that some of the symptoms of a sleep disorder may overlap with symptoms of attention hyperactivity, ADD or ADHD. So I think we get referrals from there too. So I think it's happening, and we're moving forward. Is it perfect? No, there's plenty of work for all of us to do. But I feel that pediatrics is a field in general that's nimble and that has to read in between the lines, because the guidelines aren't always set up 100% clear, because new information is coming down the pipeline all the time. It's one of those areas where I think people with pediatric background understand how to be nimble and how to be pragmatic. And I think that sleep is now being included more than ever in conversations in other types of clinics. Neurology, headache clinic is another one where sometimes we're getting more sleep referrals from that. So we're growing. Yeah. So in terms of recent events that have had a major influence in one area or another of the field, I would say the wholesale shift from in-lab polysomnography to home-based sleep apnea testing has had a major impact on the field. And there have been some benefits, and there have also been some pain points related to that. I think next, so that's something we could discuss. Other things, I think incremental improvements in the therapies that we know work best has been very important in the field, because, for example, CPAP is a fabulous therapy for treating obstructive sleep apnea, but it has to be comfortable enough and user-friendly enough to be able to use that therapy. And so things like a smartphone app where a patient might be able to follow their own progress, these incremental improvements actually make a big difference in day-to-day care of our patients. I think from a field perspective, certainly the pandemic has had a major influence on clinical sleep medicine, but also on research for a number of reasons. And my feeling is that the academy and the field has responded admirably under the duress and uncertainty of the evolving worldwide pandemic, and we're stronger for it. And we're thinking a little bit more seriously about how to prepare for the next unforeseen challenge. And I think that's a good place to be, to understand what we need to do in terms of a rapid response team type of reaction to unforeseen circumstances where the entire field may be upside down overnight. And a good example, a really pragmatic example of one of the things that started in the pandemic that I think really has been a service to patients is telemedicine. It's not for every circumstance, but there are a variety of circumstances where being able to follow up with patients, see patients who might have had to miss a whole day of work in order to drive to the center, a child who might already be struggling, might have to miss a whole day of school to get their follow-up care, that can now be achieved so much more seamlessly and in such a much more patient-centered way. So I think that's been an excellent example of a lesson learned and how we can do better for our patients. My 3 a.m. brain says no. I'm trying to think. Like, I know it'll be something that I think about on the drive home. I think that if I didn't articulate it well already, I think one of the things that I learned from Stanford that's been so special about this place is the need to give to something bigger than your own self. And it might be through research, it might be through teaching, it might be through advocacy, it might be through volunteerism in the academy or in other organizations. But we're a young field, and they need to engage and contribute to the growth of the field, educating the next generation of researchers and physicians that will come behind you. That's where the fire is in this field, and that's something that Stanford taught me from day one, and I think that fire continues to burn and grow, and that's been sort of the amazing thing about being here and being part of this growing field. The AASM is the right organization at the right moment to serve patients, to serve sleep medicine, and to serve the growth of this field.